Salam Sejahtera and a very good afternoon to our distinguished members of the National Coalition for Mental Wellbeing, in short NCMW, initiated by Rotary Malaysia, and respected media representatives. My name is Citra Panirselvam, and I'm a practicing psychologist from the Mind Faculty, Psychiatry and Psychology Specialist Medical Center. It's an honor to be your MC for today. So just a brief description about NCMW. It's an initiative by Rotary Malaysia, established to advocate improved support for mental health through its 6 focus groups, which are youth and adolescents, psychosocial, mental health in workplace, task shifting, stigma and discrimination, and decriminalization of suicide. NCMW's membership comprises of over 30 NGOs, institutions of higher learning organizations, and professional bodies working hand in hand to champion a single cause for our country, that is mental well-being of our people, including our children, youth, adults, and elderly. Today's session showcases the passion and persistence of the suicide decriminalization focus groups in advancing their cause. It is with great pleasure I would like to welcome all of you for today's momentous press conference to discuss on the topic of worrying trends in suicide rates. First, let me guide you through some simple house rules to ensure a smooth and positive experience. To keep background noise at a minimum, kindly mute your microphones. Kindly display your names and the organizations you represent, and please turn on your videos. As for members of the press, kindly indicate your name and your media organizations. Questions from the audience will be answered at the end of the session. As for the press representatives, you may type your questions in the chat box, and we will invite you to speak during the Q&A session. And for the benefit of our audience who are interested to read our media statement in full, kindly refer to the Google link. Thank you. And now it gives me great pleasure to introduce our esteemed chairperson for today's conference, Datuk Dr. Venugopal Balchan. He is a renowned cardiothoracic surgeon at Pantai Hospital, Kuala Lumpur. He's also the project lead for the NCMW Suicide Decriminalization Subcommittee. Welcome, Dato'.
Thank you very much, Citra. On behalf of the National Coalition for Mental Wellbeing and the focus group on decriminalization of attempted suicides, it is my pleasure to welcome members of the media for today's virtual press conference. Thank you for attending. In my work as a heart surgeon, I do mend broken hearts. And I'm not sure whether that is one of the reasons why NCMW asked me to lead this task force. But I must say that it has been an absolute pleasure to work with such a passionate and dedicated group of individuals whose only aim has been to positively address the issues affecting the mental well-being of our fellow Malaysians. Let me come straight to the point. If an individual attempts to take his or her own life, it is not a crime. It is a desperate cry for help. It is not a criminal issue. It is a medical issue. The victim should then not be hauled to the police station for remand. However, should be taken to a medical institution for urgent medical treatment. Unfortunately, our current laws treat suicide attempts as a crime. They add insult to injury and delay or occasionally deny the psychological support and the psychiatric treatment that these poor individuals so very much deserve. The aim of this focus group is to convince the government that the time is now ripe to repeal Section 309 of the Penal Code. This pandemic has been especially harsh on a lot of people, on even the toughest of minds, let alone the emotionally susceptible. With our suicide rates skyrocketing, I think the time to do something is now. I would like to acknowledge the fact that very many NGOs and ministries have indeed worked very hard in the previous years to address this issue. Most importantly, the Ministry of Health and the Attorney General's Chambers, or the AGC. But somehow their efforts have not borne fruit. There has always been a problem at the last hurdle, which is the Parliament and actually passing the law. And this is where we, the NCMW and the focus group, humbly and with folded hands, request the power of the media. Please help to spread the word that suicide prevention is ripe to be done now. And two things certainly will change if Section 309 is repealed. One, and the more important thing, is that people with mental health issues will be more willing to come forward to seek treatment. And second, the issue of stigma that is associated with mental illness will probably be addressed more holistically. And so a change in law will set a domino effect of so many other good things, so that the people who need the help will actually be able to get it. Besides the names in your press kit, I would like to acknowledge the contributions of a few people who have made this journey possible, who have helped us start the journey, and we look forward to finishing this journey by the end of this year at the latest. I would like to acknowledge Dr. Rajkumar Narayanan, Juan Sitti Sabeda, Ms. Sangeet Kaur Dio, Ms. Shanti Abraham, Mr. Mohan Ramakrishnan, Dr. Ian Lloyd Anthony, and Ms. Kanages, who I think has been part and parcel of this focus group on decriminalization of attempted suicides. I sincerely hope that the media present here today will take it upon themselves to convince the various people in the corridors of power that the time is now ripe for a law reform. Ladies and gentlemen, I have two experts on the subject matter with me, and it now gives me great pleasure to invite Mr. Justin Victor, who is the chairman of the Befrienders Group and who deals with this unfortunate tragedy on a daily basis, to come and share his thoughts with us. Justin, the screen is yours.
Thank you, Dr. Venu, and good evening to all members of the press and our dear friends gathered here who are concerned about the country and its people. I think the key point so far has been the timeliness and for the need of the action now. I think everyone knows and has seen these numbers being bandied about by no less than the Director General of Health and other people, from the police official numbers. Simple fact, simple, clear, painful fact, the numbers are increasing. So I won't go into those specific numbers, but one of the kind of hidden element behind this, we are looking at those, we have so far looked at those who have died by suicide. The horrible word being used because of the law as such is that they have committed suicide. It is not a criminal act that they have done. But the other hidden fact that we are here to address is about how many others are attempting to end their lives. So all of the research shows that for every person who has died by suicide, at the least there are about 20 others who have attempted suicide. So if we now have figures like something like 4, maybe some say 3 per day, we are talking about 80 or so to 100 actually attempting suicide every day. Now, the problem or the issue with that is people are attempting suicide because of all kinds of different issues, mental health problems, needing help. But if they were to be caught out in the act or actually seek help after the attempt, there is the threat of them being charged. And this is not a distant mythical threat, because we have seen in last year itself, few, and these are just the few that we know of that were reported in the media. We do not have official numbers of how many people actually have been charged. But among the few that have been charged, they are being charged for taking their life, unemployed, someone who just came out of prison, and then they are being imposed fines, some of them several $1,000s, and on unemployed person put into prison 6 months, 1 year, different periods of time. Definitely not a step that is helpful for people who are going through that problem. So back to just the numbers and why it is urgent. Whenever we are seeing a rise in the number of suicides, basically we also then can have behind the scenes what's happening is in the rise in the number of people attempting to end their lives. And we want to make it easier for them to actually come forward with help, be brought to help without them having the fear of it being criminal. So maybe I'll leave it at that for now and take some questions later. We now, is the MC going to introduce our next? Yeah, thank you.
Thank you so much, Justin. And yes, we will take questions at the very end. Once again, I remind the media that any questions can please be put into the chat box. If anyone would like to ask questions in person, please, we'll be more than happy to answer. It is now my great pleasure to introduce Datuk Sri M. Ramachelvam, who is an important member of the Decriminalization Focus Group. But more importantly, he is the co-chairman of the Law Reform Committee of the Bar Council of Malaysia. And the statement that you have in your media kit was primarily authored by Dato' Rama. And so it is with great pleasure that I ask Dato' Rama to tell us about the statement and the way forward to decriminalize attempted suicides. Dato' Rama.
Thank you, Dr. Venu, Dr. Venu, for the introduction. Dear members of the coalition, as well as members of the focus group and members of the media, a very good afternoon. I would just like to highlight some of the matters that are stated in the media statement. First and foremost, in Malaysia, the act of attempting to commit suicide is a crime punishable by law under Section 309 of the Penal Code. The punishment provided for in the law is for a term of imprisonment of 1 year or a fine or both. I'm sure most of you have read there have been cases where persons who have attempted to commit suicide have been fined, as well as some of them have been imprisoned. This is one of those rare offenses in our penal law where if you succeed, or rather, if you do not succeed in the crime, you will face punishment. To go back on this area of the law, it is part of the colonial era law that exists in many Commonwealth jurisdictions, because this was enacted in 1936 when we incorporated the Indian Penal Code to the Malaysian Penal Code. However, if one looks at the progress on Section 309, it has been decriminalized in England itself, in the United Kingdom in 1961. It's been decriminalized in India, Sri Lanka, Singapore, Hong Kong, and so on and so forth. Most of the common law jurisdictions have decriminalized this. According to the World Health Organization, Malaysia is one of the 25 countries that still maintains penal sanctions for an attempt to commit suicide. In ASEAN, it is one of the 3 countries, alongside Myanmar and Brunei. Generally, studies have shown that suicide legislation has no deterrent effect. Having decriminalized suicide, I think countries have seen no increase, no decrease in suicide. The data doesn't show that decriminalization increases suicide. In fact, there is data to show that decriminalization actually tends to reduce suicide, because people tend to then avail themselves of medical help, mental health help, and so on and so forth. This is something that I came across in, according to WHO, the strongest risk factor for suicide is a previous suicide attempt. So therefore, it is quite important for us to recognize that the suicide legislation, Section 309, does not deter suicide. In fact, decriminalizing it should lead to a decrease of suicide, as the press statement says. Decriminalize attempted suicide to save lives. Dr. Venu spoke about the various attempts that have been made. Many organizations have actually come out to ask for this law to be repealed. We have seen the government's commitment back in 2012 when the Law Reform Committee in the Prime Minister's Department under the Law Ministry actually started a review of this Section 309. Subsequently, in 2012 as well, the Minister of Health has also called for the repeal, saying that the law is no longer relevant. In 2019, June, the then Deputy Prime Minister, Dr. Wan Azizah, agreed that Section 309 should be reviewed. In February 2020, V.K. Liew, the late Minister in charge of law, said this: these people who attempt to end their lives should not be punished, but rather given medical help, because they are probably going through tremendous pressure in their life. And he had actually said that the Attorney General's chambers will be directed to proceed to decriminalize Section 309. The latest development as far as the government is concerned was the parliamentary reply given on the 2nd of December 2020, where the Prime Minister's Department had said, the Attorney General's chambers, and I quote here, the Attorney General's chambers is also considering proposals from stakeholders to remove attempted suicide from the criminal justice system and place those who have tried to kill themselves in the healthcare system to receive the appropriate treatment. This is what the government's commitment has been. So therefore, the NCMW and our focus group, we call upon the government to take the steps that we have stated in our press statement in para 6. First and foremost is to expeditiously table the relevant legislation in Parliament to decriminalize suicide. This is the way forward, and I don't think so there is any disagreement on this, because it doesn't work as a deterrent. The moral argument doesn't stand. The other call that we would want to highlight is to withdraw pending charges under Section 309 of the Penal Code, and to impose a moratorium and not prefer any charges under 309, Section 309, until the repeal of the law. And we've also proposed that the sections 10 and 11 of the Mental Health Act 2001 be operationalized so that persons who attempt suicide will undergo psychiatric evaluation and obtain psychiatric care. And we've also provided for other areas is to provide a compassionate care-based approach. And we've called for the collaboration between mental health professionals and service providers. With that, I'll end and probably take questions if there are any. Thank you very much.
Thank you for that very comprehensive review, Dr. Rama. Do we have any questions? I don't see any in my chat box. Is there? Are there any other questions from the media? Would anyone like to come on screen and ask the experts? While waiting for the questions, we at the focus group and at NCMW realize that this is not a sprint. This is a marathon. And this marathon has been going on for 20 odd years. But circumstances are so dire now that I think repealing Section 309 is a priority. And that is where we want the help of the media to not only spread the awareness even amongst members of the government, but also members of the lay public that, we cannot treat a person with a mental health issue as a criminal. He is not. One day, who knows, you and I might be in that position the way things are going. COVID has really smashed everybody's brains, if I can say that. People are losing jobs. People are failing in relationships. People are getting separated, husband and wife. Children are not going to school. A luxury condominium used to be a lovely place to live in, but today it's a convenient height to jump out from. So, we really need to passionately embrace the very fact that our fellow Malaysians are suffering. And if there is anything we can do, we should do it. And if changing the law is the first step, let us do it. And I think we have more than enough capable people in these various organizations who can help. And I think my message here today as chairman of this focus group and as a member of NCMW is that, yes, we do realize that there are so many stakeholders, but we just hope and pray that they all come together because there are people in dire need of assistance. Any other comments?
So we have a question from Annabelle from Malaysia Kini.
Yes.
Hi. Yeah.
Hi,
Annabelle here from Malaysia Kini. My question is for Mr. Justin from Befrienders. I'm just wondering, just in maybe the past 2 years or maybe in the past few months, has Befrienders seen, more than usual calls of concern, people calling about, needing mental health help or anything like that? Just wondering if you've seen any trends or any patterns. Yeah.
Yes, definitely. There's been an increase consistently for the last few years, and more recently. Yeah. And among those are a lot of people who either attempted or are thinking of attempting. And they do mention, some of them, about the fear or the issue of not wanting to get help because of how the legal system is, that they may be found guilty, that they may be found or charged rather and arrested. So thereby blocking their help-seeking behavior. Don't have full statistics on this, but anecdotally, this is coming up every once in a while.
I believe YB Kasturi Patu is here with us and she wants to ask a question. YB?
Thank you so much, Mr. Venugopal and Datuk Rama. I was actually invited by Sangeet Kaur to this event. I joined in a little bit late, but I thank everyone and I heard what Datuk Rama had to say. I just like to share my conversation with a police officer I had a few days ago regarding the suicide rates in Penang and the attempted suicide rates for 2019, 2020, and from January to May. Uh, and so we had a bit of a Q&A, and his opinion and his view, I believe, and I think might be shared by many of our friends in the police force, is that Section 309 must be still kept in the penal code because they want to use it to deal with criminals who opt for suicide or to jump off a building or jump off a bridge to escape a crime. And he cited an incident of a man threatening to commit suicide outside the IPD in SPT in Penang mainland because he was unhappy with an inaction by the police, etc. So I said, but I'm sure that is a very small number compared to the reasons why people have opted to end their lives now. And we've been calling for this all this while. But his stand seemed to be still that, you need this because he said, when I was questioning him about whether would files be open, investigation would be open on these attempted suicides. He said, of course, but then we will refer it to the DPP and finally the DPP will make a decision whether to pursue it or not. However, if someone is a criminal and they have opted to commit suicide because they can escape from a crime, he was very firm to say, yes, we will use 309 on them because we know we are very firm on that. So it gave me an opinion whether I wonder how PDRM or Home Ministry will view this 309. We are all looking at it from a human rights point of view that, Article 5 is very clear, the right to life, and because of an inaction or an ineffective government, people are driven to a point of committing suicide. And here you have, that act is criminalized. And while I was trying to get some information from him also saying that you all shouldn't be sending people who attempt suicide to the police station and opening files on them, they need help. It was a little bit, just he didn't want to say anything about it. So that's just a little bit of sharing. Perhaps for all those who are here, I think you should use social media to remind your MPs, because you only hear and see the same MPs raising the issue on suicide, with the exception of MPs who are sensitive about the issue. You don't hear the rest of MPs actually making statements or voicing out about it. Well, what is their stand? Are they afraid that their voters would go against them or don't agree with that view? So I think those who are here today should reach out to MPs on social media, tag them and ask them, if Section 309 is to be repealed, what is your stand on it? So at least we probably will build up that pressure, and also maybe how the media reports suicide cases as well. You normally find copycat behaviors, which I always call out to people who share them on social media so easily on WhatsApp groups, videos, pictures and all that, just to educate them. And it's the last respect you give a person who's out of desperation taken his life or her life, and the least they need to endure in the afterlife is to see their pictures being smeared and shared everywhere on WhatsApp and social media. So that's just my a little sharing here. Thank you so much.
Thank you, YB. Dr. Rama, you have any answer or any comments for that?
Maybe first of all, let me thank you for being one of those few MPs who takes up this issue on Section 309. I think the example given by the police is an extreme example. It doesn't represent the average normal suicide risk cases. It's somebody who threatens the suicide because they say that because they are a criminal and so on and so forth. But if they have completed the suicide, then there is no issue. If they have not completed, then it is definitely a call for help as far as the suicide aspect of it is concerned. The criminal aspect is something that they can still proceed. So you cannot use the argument that the person who has attempted to commit suicide has got some other criminal case to justify why Section 309 cannot or should not be repealed. I think it's a false argument by the police. And that's something that we should not fall for, to take the most extreme example and try to justify why you need this. And even if that person has attempted suicide, he needs help. And the way to go about it is to provide the required psychological and mental and health assistance that's required. That's it. Thank you, Dr. Dato.
Very well said, Dato Rama. Justin, any comments on that? Have you come across?
Yes, as everyone knows, the effort at decriminalization has been going on for many, many years, more than 10 years at least. And there have been many consultations with senior police officers also, not leaving out the more recent consultations, which already led to the AGC and the Prime Minister even agreeing in principle to decriminalize. So these are isolated instances, and I think Dr. Rama nicely addresses it. And it's about the issue of confusing few elements. If that is a person who has done a criminal act, the whole penal code is there already for him to be arrested, charged, etc. There's no need for the 309 to be present at all. So I don't see the officer's dilemma unless it's a little bit of lack of understanding. There are many other options on how to remand, to arrest, etc. under the penal code. I mean, I'm not a lawyer, but I think Dr. Rama can confirm that. So we are talking about those who are clearly mentally disturbed and who did harm only to themselves. And that these kind of people are also being arrested and charged. Not the type who threaten somebody else, because there are other kinds of laws which are endangering other people around you and all that under the penal code, not under the 309. That can be used for somebody who does something like also murder, suicide, etc., etc. Thank you.
And YB Patu, just to have the last word on that, I think if somebody is already in the hands of the police and then dies for whatever reason, that's death in police custody. It's not totally, it's totally different from attempted suicide. And I think death in police custody is a much bigger issue, which we will not talk about today. But I completely agree with Dato Rama and Justin that citing extremely, small anecdotal excuses is not the right way to go about it. We have to see these individuals as those who need help. And, they cry once, they cry twice, maybe the third time they won't be able to cry again, So I think we have actually gone past the time. And
Dato', we have a question from NST.
Yes, and also from BFM.
BFM
Janya Nair has posted.
all right, okay. NST first. Is it on the
Veena?
chat?
Yes, Veena, you'd like to ask your question?
Hi. Can you hear me?
It's very vague though. Speak a little louder.
This is good.
Yes.
Please go ahead.
I think, Veena, you need to unmute yourself.
Right. Sorry. Can you hear me?
Yes, we
Yes,
can.
yes, just carry on.
Right. Could I know how many cases of attempted suicide which are
I'm sorry, we can't hear the question at all. Are you driving?
No, I don't think so. Let me.
Or maybe the other gentleman can ask first from BFM while you sort out.
Yeah, Dato, the question has been posted by Danya Nair on the chat box. She
I
says,
can't see that. I can't see that. Can you read it
I'm
out?
happy to read that out, Dato. She
Sure.
says, just wanted to hear the panel's opinion on how the current EMCO and lockdowns will affect suicide rates, especially with people who are unable to leave their homes, even for things like exercise. That's a question she has posted.
Justin?
I think that is a little speculative, and we'd really not like to go into that in this forum, especially kind of guessing. Yeah. So what we've already seen, let's just go by that. The circumstances are putting greater pressures and stresses and making people more anxious. Whether they actually end up taking their lives, hopefully not. We don't know for a fact, especially to put it down to simple things like not being able to allow to go out to exercise cannot be an indicator that there will be more suicides. Cannot be, cannot be indicated. There's so many other things that are happening. Sorry, that can't give you a more specific answer, but the rest of it is really speculative. That it will affect people's mental health, yes. I think that we can all agree and confirm. It's definitely going to make people frustrated and tired and all of those things, but whether it actually leads to suicides is another thing entirely.
There is another question from the Vibes members of the panel, from Amalina. If you can see that question to the panel she has written. I'm happy to read that out too.
Yeah, go ahead, Shanti. Go ahead, Shanti.
Okay, thank you. To the panel, she says, what do you make of Suhakam's recent call to revive the National Suicide Registry Malaysia? And how important is data and transparency as we move forward? She has posted from the Vibes.
Maybe I can give a quick answer. There is already a definite plan and funding for that. It's absolutely necessary for the data. They have expanded it to be called NSFIRM, if I'm not mistaken. So the National Suicide and Fatal Injury Registry of Malaysia. So that's in the pipeline for 2022, and which is meant to collect all these kind of data, especially, but not only limited to suicides, but then hopefully with that, we will get a much better official figures to direct policy and efforts. The last was the National Suicide Registry, which was defunct by 2009 or 2008.
Yeah, I would just like to add to that because I'm so sorry, Amalina here from the Vibes for my question, because as I was doing some sort of like investigation on my side, apparently there was still some gray areas in terms of why the National Suicide Registry Malaysia was defunct. I'm not sure if any of the panels here have some sort of visibility to that, but I believe it's still very much, the issue is still very much on the community level, because people are not comfortable to talk about it as from a human perspective, right? So I'm not sure if any of the speakers here have any suggestion in terms of how, at least for us who is from the ground up, we want to kind of like move towards the decriminalization of suicide. What can we look into in terms of the next step and support bigger organizations or entities such as yourself to kind of like push this on a more national level?
Dr. Venu, maybe I can address that in my address at the end.
Okay,
what
wonderful.
The actions of NCMW, what we are doing.
Sure, yeah. Thank you. But to that question, Amalina, I think data is so important. There's no doubt. It is the basis of everything that we do these days. But how much of it and how genuine it is, because to collect data on suicides is a multifactorial thing, very difficult to know whether it is actually true, not true, statistically correct, and things like that. It is a huge venture, but I think I agree with you, it needs to be taken. And I think the people in power, the people responsible are actually doing that. And I think all these things will have to come together at the right moment in time for us to move forward and help our Sikh brothers and sisters. And there was a question from the BFM, was it?
Now we have question from Rina, NST.
Hi. Can you hear me now?
Oh, loud
Yes,
and clear.
Yes.
Perfect. There's some problem with that, what you just now. Okay, so I need to ask two questions of Datuk Rama, especially, but anybody can weigh in. Do you know how many cases of attempted suicides were charged in court over the past 3 to 4 years, especially during the pandemic, last year, March to date?
Okay, we do not have statistics. You need to ask a parliamentary question or, to get this kind of statistics. Or we need to check with the registry of the courts to have the statistics. What we have is some anecdotal cases. Like last year, there was that case in Kuala Terengganu where the disabled person tried to commit suicide and he was fined 3,000. Jail 6 months. Prior to that, there was another attempted suicide case where a fine of 3,000 was imposed. So you have these cases that are reported in the press, but you don't have statistics as such of the number of cases and the cases that have been charged in court. That's one. Number two, I think the most important aspect here, Veena, is to realize that a lot of these attempted suicide cases do not get reported because medical health professionals, family members, and so on do not report this for reasons that the person may face prosecution. So many of it is covered up. Statistically, from what I know, this is a police statistics, which they say something like out of the so many X number of cases, generally about 11% of those cases are prosecuted. That is what we have.
Dr. Rama, could I ask you, right? We've heard VKLU saying this up to February, that they have to decriminalize suicide. And, they were looking into it and all that stuff. Can I ask, with your context and the coalition especially, did you guys have an idea whether a draft of the amendments were prepared and whether it's just waiting in the AG's chambers? Because in the meantime, right, while Parliament gets reconvened and all, it's going to take time. So I want to know, what's the status? Do they have a draft at this point?
As far as I know, the coalition has been in touch with AGC, but we have not got a meeting yet to formally discuss this. That's one. The Bar Council is also in touch with the AGC to discuss a whole host of things. And this is one of those things in the laundry list.
Okay.
What I'd like to highlight to you is what is the latest development, as I said earlier in my opening remarks, that on the 2nd of December 2020, that's the latest information we have, the Prime Minister's Department, in responding to the MP for Merbo's question on abolishing Section 309 of the Penal Code, said that AGC, the Attorney General's Chambers, is considering the proposal to remove attempted suicide from the criminal justice system. Just to let you know, it's actually quite a simple amendment because it's just a repeal of that particular section.
It's just a one-line thing, basically.
Yeah, it's a one-liner, hereby propose that Section 309 be repealed. That's it. So that's no rocket science, really,
So, Datuk Rama, while Parliament gets its business in order and while they reconvene and all, how important is a moratorium? Because, you see, it seems to be going nowhere and, it's not helping the cause to have this this clause in the law.
Correct. That is why the coalition feels that a moratorium is important. That is our third call. We have actually, number one, as I said earlier, is to proceed with the legislative process of, repealing. And number two is to withdraw the existing charges that are pending, if any, before the courts. And third is a moratorium. With a moratorium, what you would have is at least persons who have attempted suicide or who are suicide risks and so on and so forth would get the appropriate medical and mental health treatment that is required. You know, I think that is the very important aspect of why we need a moratorium. We hope that the government will take this up seriously.
It's especially important now, right? Would you go on record to say it's especially important now with the pandemic?
Yes, because I think if one sees the statistics that has been provided, that the numbers are like what? I think it's there in the public domain. It's 4 suicides a day, as said by the DG of Health. The number of suicides that we've had for the first 5 months is more than the entire number of suicides in the previous year, or almost some numbers which are huge. Yeah, sorry. The numbers we have, I think it's in the domain, public domain, is 1st January to May is something like 468, whereas earlier in 2020 is 631, 2019 is 609. So the numbers are big numbers. I think it's important. All the more reason so during the pandemic.
And
Thank you so much.
And Veena, just to let you know, a subgroup of our focus group headed by Ms. Sangeet Kaur is working on a new set of SOPs for the first responders. And we are, you know, the SOPs are ready. Now we have to get a dialogue with the police and the other first responders so that the whole process of how they respond to an incident will be different from how they approach it now. And that itself, that change in the SOPs itself, I think will go some way towards helping with this repeal of Section 309.
Dr. Venugopal, what do you mean by first responders? Sorry, not very familiar.
Usually if somebody attempts to take his or her own life, there's an incident, the people who are called are either bomba or the police. It's not the medical people who rush there, usually. So these people who reach the site first, the police, the bomba, or other community NGOs, they are known as the first responders. And the way they deal with the patient at that point in time is also very critical.
Thank you so much. Sorry about the difficulty just now. Thank you.
Dato', you have a question from Siti Fatima from the Star.
Sure, Siti, go ahead.
Fatima from the Star. Would you like to come online?
Dato' Venu, I think you can read her question on the chat.
Why don't you read it for me?
Citra?
Sorry, I was having some connection problems just now.
Her question is this, Dato'. Hi, I want to ask, are you calling for immediate moratorium while waiting for the law to be repealed, as in immediate moratorium and not wait for Parliament?
Rama, would you like to?
Yes, a moratorium would necessarily mean that no new charges should be proffered in respect of any cases. So whilst waiting for Parliament to proceed with its amendments and so on and so forth, because it will take time, and I don't think so Parliament in its next sitting would look into this issue, in the near term at least. So in the medium term, when the political issues are settled and they get around to doing the actual work of legislating, we hope that this would be taken up as a priority. And until then, a moratorium is an executive action where the government of the day can decide in consultation with the Attorney General's chambers that they would not proffer any new charges. That is one. So that is required. It will also show the commitment of the government that they would get around to amending the law. That is to repeal Section 309. Because the repeal process also will take time. It has to go to the lower house, the upper house, and subsequently be signed off by the King, the Gazette. And also, I think alongside with that, I think our recommendation number 2, that is existing charges should also be withdrawn against persons who have attempted suicide. So these two things are very important whilst we wait for the law to be amended. Thank you, Fatima.
Yeah. Is there any questions? Any more questions?
Not on the chat, Citra. Maybe you want to proceed.
Okay. All right. Thank you for all your questions. Thank you, dear panelists, for sharing your thoughts and facts. That was indeed a valuable and fruitful session. I would like to invite Dato' Bindi Rajasegharan, the District Governor of District 3300, Rotary International, and the advisor of National Coalition for Mental Wellbeing by Rotary, to give her closing remarks.
Thank you. Thank you so much, Citra. Good afternoon, YB Kasturi, members of the media, panel members and friends. Now, I represent Rotary Malaysia, District 3300. Allow me to give the bigger picture of our mental health agenda. Now, you have heard from the specialists in these areas. You must also understand the areas we are working on, hoping that the incidences of suicides will be reduced, as it's most likely the victims come from these groups. More than a year ago, we organized a mental health stakeholders meeting, including representation from WHO, UNICEF, Ministry of Health, MMA, MPA, MMHA, and many other related organizations and individuals in their personal capacities. And we found many issues in the mental health agenda that required concerted effort and attention. All the stakeholders were doing excellent work in their individual capacities, but it was not enough. Much more needed to be done. As a result, we created this platform of the National Coalition for Mental Wellbeing to bring together all stakeholders and provide a centralized strategic coordination of efforts in a few identified areas. Now, it's important for you to understand the various areas that we are working on, as it's from these areas that the victims of suicides originate. Decriminalization of attempted suicide is one of the 6 areas of focus that we are addressing in the mental health agenda at the national level. Now, the second area we are working on is youth and adolescents. Focused training for school and college counselors in mental health first aid, where they will be able to identify children suffering from stress, anxiety, and depression, which rates about 500,000 school children pre-pandemic, according to the latest NHMS report. Now, counselors, school counselors, and college counselors will then be able to know how to address these issues and where to refer in case they are not able to handle it at that level. But the approach at schools and colleges are a wholesome approach. Besides training school counselors, we would also like to educate parents and establish parent support group, and to complete the picture, the peers in schools and colleges also need to be aware, and we are doing this in a fun and acceptable way by establishing Mind Matters Club, whose purpose is to also destigmatize mental health among the youth. The third area of focus is psychosocial support training. We are targeting frontliners, as in police and bomba, primary care and community health workers, providing non-therapeutic intervention support targeting public awareness and mental health literacy. The fourth area of focus is mental health in the workplace. Recently, we touched base with a few hundreds of employers through a couple of Zoom sessions to talk about mental health at the workplace, and the response we received requesting for assistance was really disturbing. What they said also affirms the fact that many do not know what to do, where to go for assistance, not realizing there is help out there. The fifth area is in task shifting. Here it's all about training volunteers and empowering non-physician healthcare. Sixth area is stigma and discrimination, which we are addressing by having public campaigns and webinars through our monthly third Thursday talks, which is an avenue for public to ask questions and learn about mental health related issues. Now, how do we do all this is through the members of the National Coalition, which comprises of psychiatrists, psychologists, counselors, and many organizations who have the expertise and professionals in this field. We work closely and are guided by the Ministry of Health and other relevant ministries, as this is a very sensitive and complex agenda. We also have UNICEF, UNHCR, and WHO as our advisors. Now, this is all about harnessing the knowledge out there and redirecting it and focusing on the various areas in a concerted and well-planned manner to achieve impactful and sustainable results to reduce the number of suicides and attempted suicide. And I must put on record here Rotary Malaysia's initiatives during this ongoing pandemic. We are trying our best to supply food. We have established blessing shelves, which are food banks, and our catchphrase is, take what you need, give what you can. And this is found all over the country. We are also providing laptops for school children, exam year students, so they don't go to the extreme and their studies are not disturbed. For jobs, we have 2 platforms where those who have lost their jobs can register, and we will try and get them placements. And in the meantime, we give them training in upskilling their skills. And in health, we are promoting the importance of vaccinations and addressing the issue of mental health during this pandemic through awareness and promoting our helplines. We have about 9 helplines who are members of this coalition. Now, I end my presentation by reaffirming our appeal on compassionate and humanitarian grounds to look into this issue of decriminalization. Thank you.
Thank you, Dato' Bindi. Ladies and gentlemen, we have reached the end of today's conference. This is indeed a crucial milestone in our efforts to repeal the Penal Code Section 309. I hope that this press conference will catalyze the translation of our papers into policies reform. I believe that through our collective efforts and voices, change is on the way. Thank you to the Decriminalization Group, Focus Group, for your hard work and the media crew present today for disseminating and amplifying our noble agenda. Once again, on behalf of National Coalition of Mental Wellbeing by Rotary Malaysia District, I thank all of you, your participation. Have a pleasant evening and stay safe. Thank you.
A person's real situation may not always be obvious. Emergency workers are often the first on the scene to a mental health crisis or suicide attempt. They have a pivotal role to play in what happens from there on. The person they are called out to help will be in need of support, empathy, and kindness. Always treat situations like these as serious. Encourage the person in difficulty to talk, be the bridge to follow-up care. Emergency workers should also look out for each other, because sometimes they need help too. A few words can make a world of difference.
Thank you, everyone.
Yep,
we have already finished the formal part right now. So once again, thank you, Citra, our MC for the day, Dato' Venu, for chairing this, Dato' Rama, and also Justin for being the co-panel on this. We really hope that our efforts will, be fruitful, and the media could be our voice. Members of the National Coalition who is present, as well as the District Action Group, we really need to work this together, and let's work this whole thing out. Thank you very much once again.
Thank you, everyone.
Bye, everyone. Thank you.
Bye.
Thank you, Dato. Thank you,
Have
panel.
a pleasant
Bye,
evening.
Justin. Take care. Stay
Bye.
safe.